Hi, I'm Gavin Giovannoni, Professor of Neurology from Barts in the London School of Medicine and Dentistry. I've just presented a interactive case presentation series highlighting the complexities of managing people with active relapsing multiple sclerosis in the modern era. As part of the course, I give 2 sessions on case histories, and I try and select the cases from my own practice to illustrate issues around the management and diagnosis of MS. So my first set of cases were really diagnostic dilemmas. These were people that had been misdiagnosed as having multiple sclerosis that after reinvestigation turned out to have alternative diseases, and this is very important simply because some of the treatments we use for MS now could make those diseases worse, and also labeling people with an incorrect diagnosis has major implications at a social and economic level for people with the disease. And so the first session really focused on diagnostic dilemmas. The second session really was looking at relapsing disease and how we manage it, and how we classify patients' disease activity in relation to the NHS England guidelines for prescribing disease-modifying treatments. So what I presented was a series of cases with difficult to manage MS in terms of their activity and treatment decisions, as well as their monitoring requirements and how to de-risk their therapies in terms of life-threatening adverse events. So for example, one of the patients I presented was very poorly adherent to her injection therapy, broke through and had rapidly evolving severe MS, had gone on to a high efficacy infusion therapy, and then became JC virus positive and was at risk of developing PML as a complication of the treatment, and how we managed to de-risk the therapy and switch on to another treatment. So none of the cases are simple, but they are real life cases and illustrate how complex the management of multiple sclerosis is becoming in the modern era. So I try and make the case presentations interactive as possible. I always pose questions along the trajectory of the case, and then I have a show of hands to see who supports this treatment decision or that treatment decision. And I think that illustrates that although we would love to have well-defined treatment algorithms, the management of multiple sclerosis is still an art, not a science, and you have to individualize decisions for individual patients based on specific characteristics. And I think that's the real learning experience that we get out of this course. People come away knowing that there are no hard and fast rules, but they need a therapeutic approach, and hopefully they will gain experience by seeing these cases in terms of how they manage the disease.